Today we're going to talk about skin cancer. All of us have skin. It's important for us to know that skin sheds. However, there are times when that process is hampered. For example, if you're exposed to UV radiation, if you have a mole, if you've had a family history of cancer, if you have skin that easily gets sunburned, absence of melanin, the darkening pigment of skin, is a risk factor. If you have perhaps a swelling, there is A, B, C, D, E that you need to look out. If it stops being symmetrical, if you divide it by 2 and this side doesn't look like this side, it's something of worth focusing. If the border of that swelling is irregular, then that's a risk factor. If that swelling has more than one color, it's a risk factor. The diameter. If it is greater than 6 millimeters, then we want to observe that mole further. And E is the evolution. If it is changing in size, changing in thickness, then that is a suspicious mole. Most of the skin lesions would be presented to a dermatologist. So for a very small lesion, it's very easy to have a surgical resection. For those lesions that are extensive, then we can use chemotherapy. And in some rare cases, we can use targeted therapy if there is a targetable mutation. We can also use radiotherapy to be able to radiate the cancer cells and shrink the tumor. As we well know, albinos don't have melanin, and that is why it is highly recommended to wear sunscreen, to ensure we're wearing long sleeved if we have to work in the sun. Wearing of hats when you're in the sun can also protect the sun exposed areas. So people developed what is called a tanning bed, where you enter and you're inside the tanning bed, and it has been shown to have a high risk of causing skin cancer. It is important for us to look at our skin. And if you have a swelling that has always been there, if any of them are changing, it is important to see a dermatologist for a biopsy to be taken and eventually treatment started for that skin cancer.